Hi, I'm Vicki Bazanos. I'm going to be doing a comprehensive head-to-toe assessment today on my patient, Lucy. It's already been determined that she is a reliable source of information, so she'll be providing her own health history today. Before I arrived, the MA that put her in the room did a visual acuity test. She has 20/20 vision with corrective lenses. Vital signs are all within normal limits. The room is well lit, it's private, it's comfortable. During the assessment, I'll be watching for any signs or symptoms of discomfort or pain. Good morning, Lucy. How are you doing?
I'm doing well. How are you?
I'm Vicki.
Nice to meet you.
I'm the nurse practitioner that's going to be doing your assessment today. Just to get started, can you tell me your full name and date of birth?
It's Lucy Barber, and my date of birth is July 18, 1987.
Okay. And what are you here for today?
Just a pre-employment physical. I got a new job, so they for the insurance you have to. Yeah, thanks. I'm really excited.
What are you going to be doing?
I'm teacher. I'm teaching. Yeah.
Fantastic.
Yeah.
That's awesome. I love teachers. So patient is alert and oriented. She's pleasant. Appears stated age. No evidence of malnutrition, and patient is clean, good hygiene. Okay. So just a general assessment. Skin is clean, it's warm, it's intact, good skin turgor. Nails are intact, good cap refill. I don't see any clubbing, I don't see any ridges. I don't see any edema in the legs. Again, toenails, good cap refill, intact, no clubbing, no ridges. Okay. I washed my hands before I came in, but let me do it again since I just touched your toes. Let's do, before we go any further with the physical exam, we'll get the health history out of the way. We'll do it now rather than at the end. So just full head to toe physical. Do you have any specific areas that you want me to focus on today?
Oh, no. No, I feel pretty good.
Okay. If the patient did have any specific complaints, I would use the PQRST mnemonic to elicit further information about that complaint, just to get a full history of that present illness or present condition. Speaking of full history of illness, history of medical diagnoses, have you ever been diagnosed with anything?
No, I just have seasonal allergies.
Okay.
That's it.
Okay. Are you taking any medications currently?
Not right now. It's not the time of year. Spring hits me. I take Claritin. Over the counter. Yeah.
Okay, just as it's written on the box. Just
just one a day max.
Okay.
Yeah.
Okay, awesome. Have you ever had any surgeries?
No.
Okay. Have you ever had any pregnancies?
No.
Okay. Any history of any mental health or psychiatric diagnoses?
No, I've been lucky.
Okay. How about in your family? Any medical history in your family? Siblings,
my
parents,
dad's a sleepwalker, but other than that, I think his dad maybe had some high blood pressure.
Okay.
That's about it. We're pretty healthy people.
Oh, good, good. Some of these things run in families, so it's good for us to know your family history just so that we can keep up with it and know what to watch for. As far as health maintenance goes, do you see a doctor every year?
About once a year, yeah. And I honestly, it's probably been a little over a year maybe since my last physical. Yeah.
Okay.
And
when was your last PAP?
2 years ago.
Okay.
Yeah, but it was normal. So I said I'm off the hook for another year.
Awesome. Do you do breast self-exams?
I do, yeah.
Okay.
After my period.
After, not during.
No.
Okay, because during your period it can have funny lumps.
Freaked out once, never doing it again.
Oh no.
Yeah.
All right. And besides the seasonal allergies, do you have any other allergies?
Oh no.
Nothing. No allergies to medications.
No, just some random plants.
Okay. Do you smoke?
No.
Do you drink?
No.
Do you use any other drugs
No,
recreationally or anything? Okay, that's good. That's a nice healthy move there. And you said you're getting a new job, a new teaching job. How long have you been a teacher?
For about 6 years. I'm moving into a new school district and I'm starting in the 2nd grade. So I'm actually really excited about that because with the littler kids, so that'll be nice.
Age.
Yeah.
So are you from around here? Do you have a good support system?
I do, yeah. I'm actually moving back into my family area. So that's really nice to have family around.
Because big life changes need some good support.
Yeah.
Okay. You said that you don't really have a significant health history. I'm going to run through just a whole bunch of things. You don't have to shake your head or say no to everything. Just stop me if anything is positive. Okay? Any chronic headaches, dizziness, lightheadedness, loss of consciousness, double vision, earaches, sinus congestion, drainage, bloody noses, sore throats, any exudate in your throat, difficulty breathing, chest pain, chronic wheezing, any chest pressure, numbness, tingling anywhere?
No.
Any stomach problems, GI stuff, constipation, diarrhea, bloody stools, difficulty with urination,
No.
frequent UTIs. Okay, any issues with your joints or your muscles?
No.
Okay. All right. Good stuff.
Yeah.
Okay, so now that we got that out of the way, let's go ahead and start with your assessment.
Okay.
Okay, so we already did just a general physical assessment. I'm going to start with your head and kind of work my way down. Okay. So palpating your head, I don't feel any masses or any irregularities. Your head is normocephalic. Any pain when I do that?
No.
Okay. If you feel any pain, if anything is discomfort, anything causes you discomfort while I do this, just let me know so I can stop doing the annoying thing.
Yeah, absolutely.
Can you take your glasses
Oh,
off?
yeah.
So I'm going to feel a couple other things on your head. Let me know if there's any tenderness. Okay. Frontal sinus, ethmoid sinus, maxillary sinus. No. Okay. Pinna, mastoid process. Okay. Nice. Tight bite down, okay, so checking your masseter muscle there and open wide. Okay, I don't feel any clicks, I don't feel any problems with your TMJ, any tenderness, any discomfort when you open and close like that?
No.
Okay, lymph nodes, preauricular, postauricular, occipital, tonsillar, submandibular, submental, anterior cervical, posterior cervical, deep cervicals underneath this muscle. It's kind of hard to get to, but I don't feel it. Shrug your shoulders for me, okay. Supraclavicular, I don't feel anything there. Okay, gonna check your eyes just with a light real quick. I'm gonna look in your eye, just look at the wall. Okay, pupils are reactive to light. Okay, direct and consensual reaction. Sclera is white. Irises and pupils are round. Conjunctiva is nice and pink. I don't see any drainage. I don't see any masses. Try to do all the glasses off stuff first. Okay, let me look in your eyes. Okay, and I see a red reflex from out here. And then looking in your eye, okay, I'm going to try to visualize the optic disc. Okay, make sure it's got nice sharp edges. Okay. Okay.
Okay.
Seeing spots in that eye now.
Little floaters, yeah.
Sorry about that. Okay, you can put your glasses back on now. Okay, I'm gonna have you focus just on the end of this. Don't move your head. Just look at the pen light. Okay. Make a big X. Okay, and then in towards your nose. Okay. So extraocular movements are good, and convergence is good. So that's cranial nerves 3, 4, and 6. Go ahead and look at the back wall. Okay, and when I say go, I want you to change your focus to my pen light. Okay,
sorry.
So, ready and go. Okay, so pupils react to accommodation also. Okay, and the fact that you were able to look at my pen light and see it, that tells me that cranial nerve 2 is working. Okay, I had you bite down earlier. That's part of cranial nerve 5. Can you feel my fingers there?
Yeah.
Okay, and here?
Yeah.
Does it feel even on both sides? Okay, so that's cranial nerve 5. Tells me that's working. Puff out your cheeks for me. And raise your eyebrows. Clench your eyes shut. Show me your teeth. Okay, so that's cranial nerve 7. You're able to move all of your facial muscles. We're going to do a few hearing tests here. This will tell me if cranial nerve 8 is working.
Okay.
I know it is because I don't have to shout for you to hear me. But we'll do the test anyway. Okay, so this is the Weber test. Do you hear this in your right ear, left ear, or both?
Both.
Okay. Next, I already checked your mastoid. I know it's not tender. I'm going to put this on your mastoid process. Tell me when you don't hear the vibration anymore, okay?
Okay.
Do you hear it now?
Yeah.
Okay, tell me when it stops.
Yeah.
Okay. So air conduction is longer than bone conduction, which is what we would expect. All of these tests that I'm doing on one side, I would repeat on the other side, just to check and make sure both sides are equal. Okay, so let me look inside your ear, see how your inner ear is doing. Okay. One of these little guys over here. Alrighty. Okay, so external canal is pink and clean. I don't see any exudate. I can visualize the tympanic membrane. I don't see any fluid behind it. I don't note any bulging. It's pearly gray and reflective with a cone of light at 5 o'clock. Again, would be repeated on the other ear. Would expect to see the cone of light at 7 o'clock on the other ear. Gonna take a look at your nose. We'll move on to that since I have this out. Before I shine anything in your nose, I'm gonna make sure that it's your nostrils are patent. So plug one side and breathe it, and then the other side. Okay, fantastic. Doesn't sound like you have any congestion or anything, so that's good. Okay, just gonna look inside your nose. Okay, so everything looks good, nice and pink and moist. You can see your turbinates. I don't see any excess drainage, no masses, no evidence of bleeding, and no septal deviation. Okay, I'll throw this little thing off of here because now I need to look inside your mouth. Okay, do me a favor, open wide. Okay, so oral mucosa is pink and moist. Say ah one more time. Okay, uvula rises midline. Tonsils are present, but I don't see any exudate. I don't see any redness or swelling. With your uvula going up midline like that, that tells me cranial nerve 10 is intact. Cranial nerve 9, I'm going to assume it's intact. You're able to talk. You're able to swallow and everything. To really test it, I have to check your gag reflex. I don't think you want me to do that.
No, it's fine. It works.
Okay, but we can check cranial nerve 12. Stick out your tongue, just move it back and forth for me. Okay, cranial nerve 12 is intact. Go ahead and shrug your shoulders and turn your head toward my hand and other hand. Okay, so that's cranial nerve 11. I know that your muscles of your neck and shoulder area are working. Since we're doing your neck, why don't we just finish off with our strength and range of motion. I know you have good strength. You just showed me that. Go ahead and do chin down and back and right and left. And then look right, look left. Give me a big circle. Fantastic. Good strength, good range of motion. Put your chin down in your chest. I'm just going to feel for your thyroid. Okay, swallow. Okay, so I don't feel any masses. I don't feel any asymmetry there. You've never had any thyroid problems?
No.
Okay, fantastic. Good to know. I'm not noticing any tracheal tugging. I'm not noticing any accessory muscle use for your breathing. You don't seem to be in any respiratory distress. Feeling okay so far?
Absolutely.
Okay. Give your lungs a quick listen. Deep breath. And out. And in. And out. Okay. So I would listen for breath sounds 1, 2, 3, 4, 5, 6, 7, and 8 on the front. I'm going to turn it over for just a second. Okay. So again, listening for lung sounds on the back, I would have the patient take a deep breath in and out. 1, 2, 3, 4, 5, 6, 7, and 8 to get all lung fields. I'm also going to have you say the word 99 when you feel my hands on your back, okay?
99, 99, 99, 99.
Okay, you can stay this way. I'm just going to move around the front and do the same thing.
99, 99, 99, 99.
Okay, so tactile fremitus is equal throughout. Okay, I'm going to check for respiratory excursion. Take a big deep breath for me. Just going to, okay, and out. Okay, so your ribs move out equally, evenly on both sides. Next, I need to check and see how much your diaphragm moves, okay? So first I'm going to have you, when I say go, take a big deep breath and just hold it in, okay? Ready? Go. Okay, so right there. Now, you can breathe regular for a sec. Okay, when you're ready, take a deep breath in again, blow it out and hold it, okay? Just, okay. Okay, there we go. So we have a good diaphragm excursion. You can breathe now. Good diaphragm excursion, so your lungs are able to expand well. Okay. Any problems so far? Doing okay?
No, doing great.
Alrighty. You know, one sec while you're here, I'm just going to check for any kidney tenderness. Okay, so right at your coastal vertebral angle. Okay, just a little thump. Any tenderness, any sharp pains? Okay, that's good. That means your kidneys are probably doing all right. We're going to go ahead and lay back now.
Okay.
I'm going to check your heart.
Okay.
Okay, so listening to heart sounds, I'm going to listen in 5 areas. Okay, so aortic, pulmonic, herbs, tricuspid, and mitral. Okay, I would listen for S1, S2, and any gallops or irregular extra heart sounds, S3 and S4. I would flip over to the bell, listen in the same 5 areas, 3, 4, 5, listening for any murmurs. Okay. No history of cardiac problems, no murmurs, even as a child or anything?
Oh, no.
Okay. Yeah. Okay. I am also going to feel your carotid arteries. Okay. Just going to feel your pulse. Okay. Okay. It's a nice strong pulse. I don't feel any thrill. That tells me that it's nice laminar flow through your carotids, no turbulence. Okay. Now I'm going to listen with my stethoscope and see if I hear any bruits. Okay, I don't hear anything there. Let me check the rest of your pulses while you're here. I'm so sorry. Let me make you a little more comfortable here. Thank you. Giving you half a table to lay on. Okay, so we've got a brachial pulse there, radial pulse here. Okay, I would check femoral and do popliteal, posterior tibial, dorsalis pedis on both sides. Her pulses are about a 2+. Rhythm is regular. Okay. If I was concerned about like fluid overload, anything like that, if I thought maybe you had any congestion issues, I would also check jugular venous distension. I would sit you up a little bit and see if your jugular vein was distended. You look okay. You don't have any fluid overload problems.
No.
Okay.
Whatever I take in, I pee on out.
All right. So your kidneys organ, great. Okay, let me look at your abdomen here. Okay, so abdomen is round, skin is intact. I don't see any obvious masses or pulsations. Just gonna, I'll listen first. Then I'm gonna feel your belly. Okay. Okay, so listening in all 4 quadrants. Okay. Okay, I would listen for enough time to know that vowel sounds are present and normal active in all 4 quadrants. If they weren't present or normal active, I would know the location and whether they were hypo or hyperactive. Okay, next I'm going to listen just like I did for your carotids. I'm going to listen to your other large vessels and see if you have any bruits. Okay. So aorta, we listen renal, iliac, and then femoral. Again, I would listen for any bruits. I would note the grade of the bruit if there was one. Okay, tell me if you have any tenderness when I do this.
No.
No? Okay. Alrighty. Now I'm going to try to feel for your liver. Okay. Should be right here under your ribs. Okay. I don't feel it, which is not abnormal. Sometimes you can feel just a little bit of it peeking out. Take a deep breath for me. Okay. Yeah, still don't feel it. Okay. I'm going to have you take a deep breath one more time while I push. Okay. I'm just looking for any gallbladder irritation. Okay. Okay, so deep breath. Okay. There we go. So that's the Murphy's test. You didn't halt your breathing.
No pain or anything.
And you didn't have any pain. So that tells me that you likely don't have any gallbladder irritation. Okay. Okay. And just on this side, seeing if I can feel the spleen. I can't feel the spleen, which is good. We would only be able to feel it if it's enlarged. Okay, I'm going to try to palpate for your aorta. We can't feel it on everybody, but okay, we would feel for it. Midline should be about 2 to 3 centimeters. Okay, let's see if I can feel your kidneys. We shouldn't be able to feel your kidneys. If they were enlarged, we would be able to feel them. I'm just going to push up with one hand and down with the other. Okay, I don't feel anything there. Okay. So a few other tests. I don't suspect appendicitis right now, but we're going to do the tests anyway. Okay, I'm going to press down here. Lift your leg for me. Any pain in your belly?
No.
Okay. The other test is called the obturator test. Okay, we're going to do an internal rotation.
Okay.
Any pain anywhere?
No.
Okay. Since I have your leg up, we're going to do a few little musculoskeletal things too. Okay. We're going to do the McMurray test. Okay. Sorry, I get Murphy's and McMurray's mixed up all the time. So McMurray test, we're going to check your meniscus for any pain. Okay, so a little internal rotation here, And straightening, any problems? Okay, and external, straighten, no problems, okay. And this is called the anterior drawer test. This is to check your ACL. Okay, nice and relaxed. I'm just gonna pull forward on the lower part of your leg. Okay, joint is really stable. There's no movement, so your ACL is good. Okay, and then we have valgus and varus pressure, and this is to check your MCL and your medial collateral ligament, your lateral collateral ligament. Okay, so ligaments here. Okay, I'm going to hold your leg, and I'm just going to apply some inward pressure. Any pain?
No.
Okay, and I don't feel any laxity in your joints, so that's good. A little uncomfortable. I'm going to stand on this side.
Okay.
Okay. Ligament is here. Okay. Varus pressure? No? Okay, so this is the varus. The first one was the valgus maneuver. Okay. Good?
Okay. Yeah, no problems.
Last thing I'm going to check while you're down here, hip range of motion. So flexion, external rotation, internal rotation. No problems with your hip?
No.
Okay. Alrighty. Let's sit up. This. Do you have getting up?
Oh, good. Just fix my hair. It's a wayward.
Mine does the same thing.
Okay.
Alright. We're going to do some cerebellar tests.
Okay.
What we're looking for is nice, smooth, coordinated movements, okay? So the first is the nose finger test.
Okay.
So go ahead and put your finger on your nose and then touch my finger. Okay. Nice and
Hey, that's cheating.
Okay, sorry about that. Okay, so that was good. We're going to do rapid alternating movements. So back and forth. All right, nice, smooth, coordinated movements. The last one is the heel to shin. So take this heel, put it down your shin, and the other side. Okay, nice, smooth movement, well coordinated. That's good. We're going to check some other neurologic tests. We're going to do dull and sharp.
Okay.
Okay, so this is sharp.
Okay.
This is dull.
Okay.
Okay, close your eyes. Let me know which one you feel.
Sharp. Dull. Dull. Sharp.
Sorry.
Sharp. Dull.
Okay. We're going to do a vibration test.
Mhm.
I'm going to put this on the bony prominence in your toe. Tell me when you feel the vibration and then tell me when it stops. Okay, so close your eyes.
I feel it.
It stopped. Okay. I would repeat that on both feet, and then bony prominence is on both hands. Okay. Let's do some shoulder tests while we're sitting here, okay? So the first one is called the apprehension test. Just put your arm up like this for me. Okay. And I'm going to apply some pressure toward the back. No problems? Okay. It's called the apprehension test literally because I would see a look of apprehension if you had a shoulder problem.
Okay.
Okay. Put your arms up for me and lower them slowly to the side and hold it there. Okay. And then lower them slowly down. Okay. So that's checking for any rotator cuff injuries. That's the drop arm test.
Oh, okay.
If you weren't able to slowly lower it down, if it just dropped, that would indicate a rotator cuff problem. Okay. The next one is the empty can test. So put your hand out for me like this with your thumb down. Okay. I'm just going to apply some downward pressure. Try to resist. Any pain? Any? Okay. So no discomfort. That indicates if you did have discomfort, that would indicate a muscle or possible tendon injury in your shoulder. We'll do some, well, let's keep going with the shoulders, I guess. We'll do some range of motion. So up and then down. Can you reach behind you a little bit? Okay. And then across your body, we'll do some big circles. Fantastic. No pain? Okay. Elbows, flexion and extension. Okay. Hands, we're going to do ulnar and radial deviation, and then you can move all your fingers, right? Okay. Nice tight squeeze. Okay, arms up like this again. Pull, push, push out, and try to put them together. Okay, and we already shrugged our shoulders. We'll do it again. Okay, fantastic. Gonna move to your feet, okay, or to your legs. Okay, leg off the bed, leg off the bed. Okay, push and pull. Okay, up toward the ceiling and down toward the floor. Wiggle your toes. Okay, nice circles with your ankles. Okay. You can put your knees out straight and bend them. Okay, I don't hear any clicking or popping. Any discomfort with any of your joints? No? Okay. Alrighty. let me check your reflexes.
Okay.
And then we have a few standing tests to do, okay? So first we're going to do triceps here. Not everybody has a good triceps reflex. Nice and relaxed. A little bit. Okay, and biceps reflex. Okay, and then brachioradialis. Nice and relaxed. I'm just going to look for a little jump in your thumb there. Okay. Okay, patellar. I hate this one. I always feel bad doing this to people because I hate this one.
Oh, it's fun. Up goes the wings.
Okay, let's...
It's the only impressive one I have, so, you know, you gotta get your joy somewhere.
Funny. Okay, go ahead and put one knee up on there. We're going to check your Achilles and your Babinski, okay? Okay, Achilles. Okay, you see a little jump there. That's good. And Babinski. Okay, your toes don't flare, so that's a good sign. Okay. We're gonna there's a couple other another cerebellar test, a few other cerebellar tests to do. Just again checking for coordination, balance, things like that. So whenever you're comfortable, go ahead and close your eyes for me. Okay. I'm just gonna watch for any excessive swaying. Watch for loss of balance. It's the Romberg test, and that looks good. You're not falling over, so that's a good sign. Okay. And then we're going to do some walking. Okay, let me move this out of your way. Okay, we'll start back here at this wall. Walk across for me. Okay, and walk back. Okay, we'll walk on your heels that way. And your toes to come back. And then we're going to do heel toe, one in front of the other. And you've got great balance, great coordination. And you can do the hands too. That's awesome. Okay. Let me check your spine also. Go ahead and lean forward. Okay. Any tenderness?
No.
Okay. And your spine is nice and straight. No abnormal curvatures. Okay. Stand up for me. Okay. We'll rotate to one side and rotate to the other. Lean back a little bit. Okay, can you do a lateral bend to the right and to the left? Okay, and then there's one shoulder test that I forgot. Can you try to grab your hands in the back?
Ooh, not as good as you.
Okay, and the other way, that's just checking internal and external rotation of your shoulders. And I think that just about covers it. Do you have any questions for me today?
No.
Okay.
Yeah. Everything good?
Everything's good. I'm so happy for you and your new job. I hope you have a great time with your new kiddos, and we'd love to see you back here anytime you need help with anything, okay?
About a year.
Thank you for coming in.
Thanks.
Okay. Take care.